Greetings from Suraja Institute. Ring of steel after glaucoma surgery. The ring of steel is a fibrosis around the conjunctiva which has been exposed to mitomycin C during trabeculectomy surgery. It localizes and limits the extent of the pale bleb. The posterior incision of the limbus based surgery often results in a posterior restricting scar which pushes the aqueous towards the limbus, forming a thin walled cystic bleb. They have increased risk of bleb leak and endophthalmitis. A female, 48 years of age, reported to us for routine eye evaluation. She had a visual acuity of 6.6 in both eyes. Anterior segment examination was normal in both eyes. Intraocular pressure was 32 mm mercury in the right eye and 28 mm mercury in the left eye. Gonioscopy showed open angles in both eyes. Central corneal thickness was 530 micrometers in both eyes. Fundus examination showed a 0.8:1 vertical cup disc ratio in the right eye and 0.6:1 vertical cup disc ratio in the left eye. Spectral domain OCT showed global retinal nerve fiber layer thinning in the right eye and RNFL thinning in the superotemporal and inferotemporal quadrants in the left eye. She was diagnosed as primary open angle glaucoma in both eyes. She was advised brimonidine 0.2% and timolol 0.5% eye drop combinations for the left eye. She underwent trabeculectomy with mitomycin C in the right eye. 1 week postoperatively, her intraocular pressure in the right eye was 12 mm mercury, at 1 month it was 14 and at 3 months it was 24 mm of mercury. At 3 months postoperatively, the anterior segment examination showed a thin cystic bleb with ring of steel formation around the bleb. The blood vessels appeared to stop abruptly at the border of the bleb. She was advised liverbunolol 0.5% eye drops 2 times a day for the right eye. A male, 55 years of age, reported to us with chief complaints of diminution of vision in the left eye since 1 year. He had a visual acuity of 6.9 in both eyes. He was operated for cataract surgery with intraocular lens implantation 4 years back in both eyes. Anterior segment examination showed pseudophakia in both eyes. Intraocular pressure was 28 mm mercury in the right and 30 mm mercury in the left eye. Gonioscopy showed open angles in both eyes. Central corneal thickness for 490 microns in both eyes. Fundus examination showed a 0.85:1 vertical cup disc ratio and RNFL defects superotemporally and inferotemporally in both eyes. SD-OCT showed RNFL thinning in the superotemporal and inferotemporal quadrants and also globally in both eyes. He was advised trabeculectomy with mitomycin C in both eyes. He underwent trabeculectomy with mitomycin C first in the left eye. After 1 week of the surgery, his intraocular pressure in the left eye was 16 mm mercury, at 1 month it was 18 and at 4 months it was 26 mm mercury. At the 4th month follow-up, there was a flat bleb due to ring of steel formation along with band of subconjunctival fibrosis. He was put on anti-glaucoma therapy and bleb needling was advised. In the past, we relied on the limbus-based flaps and local application of antimetaboloite due to concern about post-operative leaks. Dr. Khaw's clinical observation of all cystic blebs had 2 things in common. The first was restricted posterior flow due to a ring of scar tissue which he called the ring of steel, and the second was a source of anterior limbal drainage of the aqueous. The restricted flow from the posterior incision and an aqueous drainage at the limbus encourages the formation of anterior focal cystic bleb, a finding that was in favor of the limbus-based flaps. A fornix-based incision, in contrast, allowed a larger area of antimetabolite treatment without a posteriorly placed restricting scar, resulting in the formation of diffuse bleb. Additionally, incompletely cut sides of a large scleral flap leads to posteriorly directed diffuse flow of aqueous, resulting in formation of a more diffuse non-cystic bleb. Thus, the ring of steel can be prevented by fornix-based flap, broader application of antimetabolites, and an incomplete side cuts of scleral flap not reaching up to the limbus. Long-term control of IOP after trabeculectomy with mitomycin C can be achieved by prevention of the ring of steel formation. Thank you.